Welcome back to the Bryan Devore Connection. I'm your host, Bryan Devore. When I say the word Medicare, a lot of people have glaze in their eyes because they don't really understand what Medicare is all about, what it does, who needs it, when can you enroll in it, the whole 9 yards. So here today to talk about some insider tips about Medicare is one of my favorite Medicare professionals, David Wolfe. David, how are you?
Hey, thanks for this invite. You know I love talking about Medicare, so
yes,
when
sir.
you said come on the show, I thought, wow, a perfect opportunity to help people out there who may get confused.
Absolutely.
There's a lot to get confused about, so thanks for having me.
100%. So we're going to talk about the key things
Sure.
about Medicare, the insider tips. So what are the key things that you want people to know right off the bat?
Well, a lot of people don't know this that are turning 65. There are independent Medicare brokers that are out there that can help you, okay? I'm one of them. It doesn't have to be me, but I would definitely, to any senior about to turn 65, find an independent Medicare broker in their local area, as opposed to maybe seeing an 800 phone number somewhere and calling a call center. Different scenario altogether. Independent contractors, typically they live in your neighborhood. You can meet them physically. You could go to the Starbucks. They could come to your home. They might, have their own office, whatever it is. But they are certified with all the different carriers out there. So it is up to them to understand what the plans are, to learn about your needs, and then to bring you plans that you really should be aware of. If you go it alone, it's extremely difficult. In some areas, there could be over 100 plans. How do you learn about all of those?
Yeah. And
the other thing about an independent Medicare broker, there's never a cost. They are compensated by insurance companies. So why would you not have an independent broker? And secondly, Brian, I would say that being aware of Medicare dates is very, very important. There's something called the Annual Enrollment Period, where regardless of what plan you have right now, if you have an existing plan, you have the option to take a look at new plans that might be coming out. You might have changed your prescriptions from last year. It's good to know what else is out there. So between October 15th and December 7th, Medicare allows you to make a change in your plan for the following year, which would become effective January 1. So be aware of the dates and get somebody to help you. I really recommend an independent Medicare broker.
Well, and to your point, if you don't go to an independent broker, you're faced with calling an 800 number or what have you, and you can find those 800 numbers on all the overwhelming information you're going to get. There's going to be so much mail coming your way. How do you even differentiate from it?
And, insurance companies would definitely like to know where you live if you're turning 65, because what they can do is, in a Medicare Advantage plan, they basically take over your health coverage from the government. And many people may not be aware of this, but they are compensated by the government to really take care of you on a Medicare Advantage plan. So, of course, insurance companies would like to know who out there is turning 65, and they would like to get to you, whether it's through direct mail, maybe buying a TV commercial campaign, whatever it happens to be. So for anyone who is watching this right now, expect to get inundated with mail as you approach 65. It could even start 3 months before you turn 65. I'm going to go back to the independent Medicare broker again. So you might want to take all that mail with flashy headlines and colors and get money back on Social Security and whatever they're saying, and put that in a garbage bag to the right somewhere, and find yourself somebody you can trust who's a broker, who can work with you across your breakfast table and really tell you about plan benefits that are targeted to you and your individual needs. How could that ever happen in the mail? It's probably not going to.
Yeah, there's no way, because there's so many different plans to choose from.
Exactly.
And you mentioned, Medicare Advantage. So there is a difference between Medicare and Medicare Advantage. What is that difference?
Well, the first thing you should know is Medicare, original Medicare, Parts A and B, really picks up 80% of your coverage when you go to get something that is covered by Medicare to begin with. You can always find out what Medicare covers and does not, but that covers 80%. So let's talk for a moment about, let's say you happen to have a serious health diagnosis about something. And I know these days that can add up pretty quickly. I mean, we can be into the six figures for some surgical procedures. So hypothetically, let's say you had some kind of a surgery, an operation, and it was $100,000. Guess who's on the hook for 20% of that? You. $20,000 would be a lot of money to a typical senior these days. So by having a Medicare Advantage plan that covers your entire health insurance, essentially, you are covered from that. Now, Medicare Supplement would be another option that we could talk about, but you definitely don't want to be on the hook for 20% out of your pocket.
Yeah, for sure. And a lot of people don't understand, they have to sign up for Medicare. It's not something that's really optional. It's something that they really have to do as they're getting to be 65.
Except I would say to you that a lot of people these days are working past 65. And you do have that option if you want to. You might want to go and sign up for Part A, because if you've worked 10 years or 40 quarters in your work lifetime, essentially Part A is going to be no cost. You've paid into it already through Social Security. But now you've got that Part B premium that comes into play. And in 2022, it's $170.10. It might vary and probably will for 2023. We don't know yet just when that'll be or what that number will be. But you might be able to avoid that Part B premium if you're still working and you are with a creditable company, as Medicare defines it, which is 20 or more employees. Okay. So you might not want to pay or turn that Part B on just yet because you're getting a good deal at work. Right. If you're under 20 employees, then I would definitely sign up because you could be into a penalization situation with Medicare because you didn't have 20 or you weren't working for a company with 20 or more employees. So the Part B could be a variable for you. But for the most part, if you're retired, definitely want to get signed up with Medicare. And otherwise you could face a penalty for not being signed up.
Right. Let's talk briefly about medications, prescription medications. How does that come into play with Medicare?
Well, here's what I do. When I'm working with a new client, I would like to find out what their prescriptions are, and I can enter those based on where they live. There's a lot of different factors that go into calculating what your costs are going to be in a plan. But, and some people have more prescriptions than others. But what you want to do is really research that, put that in, find out what plan basically caters best for you and that particular formulary that you have with your medications. Now, another thing that people may not be aware of is rates can also differ by pharmacy. So you might be on a regular basis going to a CVS store versus a Walmart, wherever you get your drugs purchased. Those prices can vary as well. And then, of course, there's mail order. So when I get the list of prescriptions, I like to enter those into the online systems that we have access to as brokers and come back and say, this particular drug chain could be cheaper than going here, but guess what? Mail order could be the best of all. So all of that has to be researched, and there's not a lot of seniors that really know when they're retiring where to go to get that information quickly. There's a lot of data that needs to be really combined in, so I can come back and say, here are the top 3 plans. Let's look at each one of them and find out which works for you best.
Yeah, I cannot imagine someone getting a piece of mail and that piece of mail answering these questions and being able to address all these issues.
Right.
And it's really one size fits one. Right? Someone needs a plan that's tailored for their needs.
Right.
They have to pick the one that's going to give them the features and benefits that are best for them and their situation.
That's exactly right. And I should clarify one other point. A lot of people feel, well, whatever I can get for myself might be best for my spouse. Not necessarily. Medicare deals with individuals one-on-one. So it might be that a husband has one particular plan and for his wife, completely different plan. It varies. So we really talk one-on-one with each individual. And I try to tell people, get started early. If your birthday, for example, was in December, you can start enrolling in a plan and going through that process 90 days prior to your birthday. So the plan is, think well ahead. You want to have a good on-ramp. I've gotten calls from people before who were about to turn 65 2 weeks later. That short window of time is not the best way to handle your health care in terms of what you're going to do. So we try to get started very early, sometimes even prior to that. We go through the plans, and then what we do is once you've made a decision, because it is ultimately the individual's decision what to choose, I can only recommend or suggest. We will contact the carrier. I can do it on your behalf. We'll go through the enrollment process, and when your birthday, if your birthday was in December, your coverage starts on the first day of the month of your birth month, unless your birthday happens to fall on the first day of the month, and then for whatever interesting reason, Medicare decides your coverage will start 30 days prior to that. But for most people, it's the first day of the month. So start early and have everything in place so that you can go out and golf or whatever you want to do and not have to worry about your Medicare plan.
No, absolutely. Get started early. Get all your questions answered.
Exactly.
This is the guy who can answer those questions for you. His information is on the screen. You can contact him, whether it's for yourself or for a loved one. We have open enrollment, and so now is the time to get active and get looking at it. David, very, very nice to have you here. Thank you very much for joining us.
My pleasure. Thanks for inviting me, Bryan.
Yeah, for sure thing.